When a dog suddenly exhibits neurological signs, such as weakness, incoordination, or changes in behavior, it can be a distressing experience for owners and a diagnostic puzzle for veterinarians. Currently, the most reliable method for diagnosing strokes in dogs involves advanced imaging techniques, particularly magnetic resonance imaging of the brain. This technology allows veterinarians to visualize the intricate structures of the brain and identify abnormalities consistent with a stroke, whether it be due to a blockage of blood flow, known as an ischemic stroke, or bleeding within the brain, a hemorrhagic stroke. Magnetic resonance imaging provides detailed images that can help pinpoint the location and nature of the damage. However, there are limitations to relying solely on magnetic resonance imaging. Firstly, this technology is not always readily available to all veterinary practices due to the significant investment and specialized expertise required. Secondly, even when magnetic resonance imaging is performed, the appearance of a stroke on the images can sometimes resemble other conditions affecting the brain, such as inflammation of the brain and its linings or the presence of tumors. This overlap in imaging characteristics can make it challenging to definitively diagnose a stroke and differentiate it from other serious neurological diseases. In human medicine, alongside advanced imaging, doctors often utilize blood tests like the D-dimer concentration and a test called thromboelastography to help support the diagnosis of strokes. D-dimers are measurable substances in the blood that become elevated when the body has formed a blood clot and then broken it down. Thromboelastography, on the other hand, assesses the overall clotting ability of the blood, looking at how quickly a clot forms, how strong it becomes, and how it breaks down. These blood tests can provide additional clues that, when combined with imaging findings and the patient's clinical signs, can aid in reaching a more confident diagnosis in human stroke cases. Given the challenges in diagnosing canine strokes with magnetic resonance imaging alone, and the utility of D-dimer and thromboelastography in human medicine, researchers in veterinary medicine sought to investigate whether these blood tests could also be valuable tools in supporting the diagnosis of strokes in dogs. Conclusion: this study suggests that while blood D-dimer concentration and thromboelastography alone are not reliable for definitively diagnosing strokes in dogs, a positive D-dimer result might serve as a reason to pursue further, more specific diagnostic testing, especially when the initial suspicion for stroke is not very high.